Hi, welcome to another episode of Urinary. Today we are going to discuss few common urologic problems. And to help us we have Dr. George.P.Abraham with us. He is a senior consultant urologist and transplant surgeon at Cochin. Hello doctor, welcome to our show. Doctor, can you just explain us what are the common urologic problems that we see in youth?
In youngsters, usually they will have a lot of psychological problem. Without knowing it properly, they will have a lot of doubts in their minds. And considering that, they will have a lot of doubts and some suspicious things and some problems, psychological problems will arise. That is very common in youngsters. Then comes some disease pertaining to youngsters. One of the most common disease seen in youngsters are the stone disease. It is very common because of their life habit, without taking much fluids, and because they are very busy in earning money in the life, then they will forget about all other things. They will not take much water, they will not give concentration on their life pattern, and that will lead to a lot of diseases, mainly the stone disease commonly seen.
Okay doctor, we'll go to the questions.
I'm Manasa, I'm from Tamil Nadu. I'm doing visual media in Amrita College of Arts and Science. I just wanted to know what do you mean by urology department and the difference between urology and nephrology?
Okay. So she has asked about what is urology and what is the difference between urology and nephrology.
Urology is otherwise called genitourinary surgery. That means that is covering the urinary system as well as the genitalia system. The urinary system, we know that starts from the kidney, then the urine is coming from the kidney by ureter into the bladder. It's a small tube. In the bladder, urine is stored in the bladder. Then after that it goes out through the urethra. So kidney, ureter, bladder and urethra. That involves the urinary system. This urine passes through the genitalia. That is why that is also included, genitourinary system. Genitalia contains, we know, the sex organs. Through that the urine also passes and genitalia functions. So any disease pertaining to this urinary system and the genitalia is dealt with the genitourinary surgeons, that is urologists. But as you asked, there is a difference between urology and nephrology. These urologists are surgeons. They can operate and correct all the problem. Nephrologists are not surgeons, they are physicians. They can only treat these by medically. But they are physicians, they cannot operate, they can treat them physically. So kidney disease, other urinary disease, all diseases are treated by physicians, by medicines. But then a common thing where these urologists and nephrologists come in kidney transplant. If both kidneys fail completely, then the treatment is dialysis, only one part of the thing. That means all the waste products are removed from the blood and the new blood, the purified blood is recirculated into the body. That is called dialysis, and that is done by nephrologists. But urologists, dialysis alone cannot solve the problem. Both kidneys have failed. Then we will have to do a transplant. We will have to put one more new good kidney into the body. That is called transplant. But there, all the preparations, evaluation, everything will be usually done by the nephrologist. When the surgery comes, we will see them and see whether that patient is fit for transplant, whether we can operate, whether we can take the kidney and do the surgery and give the best outcome. The urine should come, kidney should function properly, and there should not have any complication. If any complications come, that also to be dealt by urology. Once everything is settled, then again the medical management that has to be continued by the nephrology, and they have to continue. A continuous evaluation is done by nephrology. So that is the basic difference between nephrologist and urologist. Urologists are surgeon. They can correct all the problems by surgically and then give the treatment. Nephrologists treat them all conditions that has to be treated by medically, they will treat them, and that is the difference between urologist and a nephrologist.
What about this youth? Can they receive or can they donate a?
Ideally, youth are the best to give the kidney because they have the best kidney, the good kidney, good functioning without any disease. That is the state where we have to donate our kidney. There are certain rules because youngsters, teenagers or youngsters, if they are not married, in that age group usually we will not take, because they should be matured enough to donate a kidney. They should know the complications or the dealing. They should support their family. Considering all these factors, usually above the age of 25 only usually we take. But in an accident, for example, cadaver kidney transplant in youngsters, teenage, if that happens, we take that kidney. But voluntarily donating, usually after the age of 25, we will consider them. Up to the age of 50, they can give. But before donating, blood donation is another very common thing. Anybody can just go and give the blood. There is no much problem, age bar. But this organ donation, usually between this age group, what we have to do, we have to evaluate the patient completely, do all the tests and make sure that he is not a patient. He is an absolutely healthy individual. Only an absolutely healthy individual, out of it we have to prove that there are 2 good kidneys are there. Only if 2 good kidneys are there, we will take only 1 kidney for donation. Other good kidney has to be there for the person who is donating the kidney. And this kidney what we are taking, that should be good for the transplanted patient also. It should function properly. So 1 kidney is enough for a good life, either for donor or for the recipient. So youngsters, they can give kidney, and that is the best kidney, not an elderly age group, not a teenage or younger age group. The middle age is the best kidney they can donate.
Doctor, you mentioned about the cadaveric transplantation, but all these prerequisites, all these criteria, what you have mentioned, cannot be implemented in this cadaveric. So what is the procedure in that, doctor?
See, cadaver transplant, only very recently the awareness has come up significantly, and a lot of kidney transplant, organ donation, organ transplant is happening only very recently. Previously, 4-5 years ago, it was not so common. Very rarely one cadaver transplant was taking place. But here what happens is, once an accident happens, if the brain injury occurs, and if once the brain is totally dead, we have to prove that brain is dead by some apnea test. That patient will be on ventilator. The life is maintained only by ventilator as well as certain medicines. Because our central government is the brain that controls the whole body, regulating everything. Once that is out, that is gone, we can maintain that life only for some hours only. After that, all system will failure and the patient ultimately will go to death. So his heartbeat, blood pressure is maintained by ventilation and medicines. Once you switch off that ventilator, immediately brain will be, brain already dead, all other system will stop. So that is one of the important tests. That will take 2-3 tests will be done, prove that that patient cannot survive. Then only we will ask for organ donation. At that time, once the circulation heartbeat stops, every organ will immediately, that will become decayed. So that cannot be used. Before that, once the brain dead happens and before the heartbeat stops, that some hours are there. There we ask for whether you are willing for cadaver donation. There, if they are willing, immediately we will prepare the recipients and we will take out these organs, and that can be given for transplant. But before that, again we will take some test whether that organs are good for transplanting the other thing, basic test. But even after taking that organ also we will see and whether the artery, vein, other things, everything is good. If it is totally gone, if it cannot be transplanted, we will not take that organ. Otherwise we can take. Some essential basic tests will be done within that few hours it will be done. And we will take. And it is becoming more common and popular now.
Okay, doctor, we'll go to the other questions.
Morning, ma'am. My name is Amal. I am from Tripunithura. Done my graduation in BBM. I have a question, ma'am. Like, what are the common urinary diseases in youth?
So he has asked about what are the common urologic problems.
Nowadays, one of the most commonly seen disease in youth is urinary stone disease, very common. But previously, urinary infection due to gonococcal infection was one of the common findings. But nowadays, it is well treated, good antibiotics, all almost under control. So that is not a very common thing. But nowadays, for youth, the stone disease has come out a common thing. In males, whereas in females, urinary tract infection is another common disease in youngsters. Due to many various reasons are also there, because youngsters, they are busy in their work, they will not take water, because how these stone disease occur is because when our intake is much less, what happens, the urine will be concentrated. Once concentrated urine occurs, crystals will occur there. Once crystals occur, it will aggregate together and to form a stone disease. So the basic treatment itself is dilute the urine. That is possible only by taking plenty of water. You dilute the urine, that crystal aggregation, crystal formation aggregation can be prevented. That is one method. So that is one thing, but even after we repeatedly telling the patient, they will not listen to that. They will ask what other treatment, what we have to do for stone disease. And this is the basic technique by which we can prevent a stone disease. The same thing is in urinary tract infection also. Most important thing is we have to take plenty of water, because the organisms are there in our body itself. It is waiting for an opportunity to activate and to produce the symptoms and so before that we have to wash out all these organisms from our body. So once we take plenty of water, and the urine also increases, urine quantity will increase, and that will wash out all these organisms from our body. And again, it will take some time to activate. And taking plenty of water, increasing the output is a very, very important thing to prevent two most commonly seen disease in urology, especially in youngsters: urinary infection and a stone disease. The various reasons are there to precipitating all these conditions. That is entirely different. So we'll have to do a lot of steps to find out why these occur. Any other reasons apart from this is a basic thing. Apart from that, many other reasons will be there. That is to be evaluated. We have to find out, and then we have to treat according to the reasons causing these problems.
So, doctor, what are the other treatments of stones, urinary stones?
Stone disease means once the patient comes, usually these youngsters come with an acute pain. It's a ureteric colic, but that usually occurs in the night or sometime. With a very severe pain at the time, unknowingly the patient will be vomiting and the patient will have to pass urine. The patient cannot sit, lie down or stand at that agonizing pain. That is the common presentation coming with stones. But another group comes with mild pain, discomfort, some urinary symptoms, blood in the urine. Sometimes they'll pass a stone, or various symptoms will occur. Then we have to evaluate and first. The most important evaluation is to find out whether that can be treated medically or whether it requires some other treatment, such as breaking the stone, by operating the stone or powdering the stone. Any method of treatment, surgical intervention is required. Once we decide that it is a medically treated, because it is not a big stone, only small stone, even if you take medication plus hydration, he may pass off the stone. But this medication, that has to be continued for a long time, because it will take a long time for a stone to form. Similarly, it takes a lot of time to prevent the stone as well as to dissolve the stone, to pass out the stone. So we have to continue medication for a long time. Once we decide that some a stone will not come out, that is a blocked system, a stone is very big, it cannot go out. Then various methods are available. The least surgically or without any complications, technique is called shock lithotripsy. Extracorporeal shock lithotripsy. That is not an operation, it is an outpatient procedure. What happens is the patient comes and lies on a table, a specially designed table, and a balloon covered one that will come, and that is called the shock. That will come and touch on the body, on the loin. And that contains full of water, and that is covered with a membrane. And by using a computerized machine, we target the stone. And once we activate, a shock wave is generated in that water, and that will transmit it to our body, and that will be concentrating on the stone only. That will slowly break the stone. Slowly the stone particles will be disintegrated and slowly. After one sitting, we give you about 1 week's time to see some of the fragments to come out. Then we take an X-ray again and see how far it has fragmented. Then again, if you see that some residual stones are there, then we give the second sitting. Because maximum 2 or 3 sittings we usually give. If the stone will not fragment even after 3 sittings, that means it is a very hard stone that cannot be treated by that method. Then it requires some other alternative methods of treatment. Once we decide that stone cannot be fragmented by shock lithotripsy, then the next method, if the stone is a small but not a very big one, that we can do a ureteroscopy, a small, long, slant instrument called ureteroscope. That can be passed through the bladder, through the ureter, and up to the kidney we can go there. We can see the stone and then break the stone by using laser or pneumatic lithotrite. By using that, we can break the stone, that we can fragment. Laser is found to be very, very useful nowadays, because that will, without moving the stone, sometimes when we break the stone, some of the fragments will go into the kidney. By using laser, that will almost something like a dissolving the stone. That will slowly powder the stone or almost dissolve. And all these fragments will come out. Suppose again, if the stone cannot be treated like this ureteroscope, even the stone is very big, it is called staghorn calculi. That means big stone completely filling the kidney. These are all big stones. There we can do keyhole surgeries, otherwise called percutaneous nephrolithotripsy. That means from outside we are creating a small, about 1 centimeter small incision. Through that we enter, an instrument is passed into the kidney, and through that instrument we can see the stone inside the kidney. And by using these either laser or pneumatic lithotrite, we can break the stones into complete fragments, and we can remove all these fragments and powder it. That is called percutaneous nephrolithotripsy.
Doctor, we have got a mail. I have heard about circumcision. Is it necessary to increase sexual happiness after marriage?
In fact, that is a very wrong concept, because many youngsters will come and they will ask, yes, I want circumcision. Then we ask, why? What is your problem? What is the disease? No, I don't have much disease or anything, but I want circumcision. We further scrutinize them. What is the reason? When we examine him, that penis is normal, skin is, prepuce is well dilated, can be retracted, he can wash, clean, everything there. Still he wants circumcision. Repeatedly asking, he will tell that, yeah, wrong. Somebody told that after circumcision, sexual life will be much better, much enjoyable. It is a totally wrong concept. Why this skin is given, this prepuce is given, is to protect the sensation of the gland. Because the glands, if the sensation is adequate, good, that it can stimulate our sexual drive, and sexual happiness will be increased by that sensation. Once we remove that skin, slowly after a period of time, that sensation will be slowly lost. Once the sensation is totally lost, that cannot stimulate, and we cannot sexually stimulate, and erection will be lost, cannot perform well, and sexual happiness will be less. That is ultimately going to happen by doing an unwanted circumcision. But circumcision is essential, especially for children with recurrent urinary infection or something. If the skin cannot be retracted, washed and cleaned well, then circumcision is a must. But many people, many parents will bring their children for urinary infection. When we examine all the children or newborns, skin will be tight. So the parents have to take that precaution, repeatedly dilate the skin and wash, clean well, because the smegma, that secretion will be there. That will, one of the reasons that will produce some infection and urinary infection in children, youngsters. So the lesson is, For every parent should know that the skin has to be retracted, washed, cleaned well. Circumcision is not the answer to prevent urinary infection. Circumcision is done only when we cannot retract the skin and we cannot clean it. But one long standing, if you don't retract, wash, clean it properly, this magma will accumulate there. That will produce chronic irritation and infection. Ultimately, after some years, that will develop into penile cancer. So that is why we advocate all the patients, all the children to retract, wash, clean daily to prevent this penile cancer in the long run. That is a very, very important thing. Second indication for circumcision is for religious aspects. Yeah, but that is their custom, their rule, they will have to do circumcision. That is for religious aspect, not to prevent urinary infection.
So, okay, doctor, thank you so much. It was really an informative talk, and thank you so much for spending your valuable time with us. So that's all for today. If you have any doubts or suggestions, write to us. Our email ID is youthdairyroseball@gmail.com. See you.